Hey everybody, I hope the multiple chemical, excuse me, still have some speech issues. I hope the multiple chemical sensitivity community slash mast cell activation syndrome slash Lyme community is doing well. As many of you may know, I had my very first mini stroke April the 15th or the 14th, if I remember correctly. So I want to talk a little bit about that. I want to talk about the dangers of treating Lyme disease. I want everybody to watch this video, and I don't want people to watch it in sympathy. I want people to take it as a learning lesson if you're going through the same thing. Because, you know, when you, sorry, I apologize for any speech impediments or tongue-tied. I'm still kind of getting over that. Hopefully can get that straightened out. If I talk too fast or I think too much, it bothers me. But anyway, what I was saying is I want everybody to take this as a learning experience, so that way you don't make the same mistakes that I do or that I did, which it wasn't all my fault. There's the details I'm going to leave out of the video because it's personal details, which I've explained on one of my posts, and I'm not going to include it in the video because I don't think it's worth including, because everybody has those kind of issues. You know, they get arguments, they get mad, you know, especially when you're not feeling good. But anyway, let's talk about what happened. So as many of y'all know, I was being treated for Lyme disease with a medication called Remission. It was a medication originally used for alcoholics. It's called anti-abuse. They done a clinical trial, and out of 2,500 people and several different medications, the most effective medication that they used out of hundreds and hundreds, and maybe it was thousands of medications, but the most effective medication or hardcore medication that they used to cure or make Lyme disease go in remission, if it was an acute infection, they use doxycycline. Chronic infections, they use like ivermectin, Remission, LND, they've used that. So my mast cell doctor felt like it was best to use Remission, and as I was saying, out of this clinical trial, it had the most positive or the best outcomes. The only fallback is it can cause a Herxheimer reaction, or what's called basically when you're treating it, the body releases toxins from the Lyme dial because the Lyme wants to survive. So it's the same way if you disturb mold, what does it do? It releases microtoxins because it wants to survive, you know. And it's kind of the same way with Lyme disease, you know. With Lyme disease, as you're killing it out or disturbing it, the bacteria wants to survive, and it wants to survive in your body. And when it does this, it can cause a multitude of, you know, different issues, you know, swelling, inflammation. It can make your sensitivities go up. And that's exactly what I seen. And my mast cell doctor, you know, he explained the risk to me, and he explained everything. And me and sensitive don't mix, so I don't like the multiple chemical sensitivity lifestyle. I don't like the mast cell lifestyle. I want to be able to cut tree limbs again. I want to be able to grind again. I want to be able to, you know, I want to be able to do most of the stuff I've done before. I want to be able to paint a little. So I was willing to take the risk, and I did. And long story short, I started the treatments back in January, and it's a taper. You start out with a quarter tablet first 5 days, and then after 3 days you take a half a tablet, and then after that you take quarter tablet every 3 days, and then you slowly progress to 2 tablets daily. And my mast cell doctor told me that you progress according to how you do. And if you have the Herxheimer reaction, you can back off a little bit. But what you do is the spirochetes from the Lyme, is what I was explaining, attaches to the red blood cells. So you have to go at least 6 months. And then if you're retested. If you're negative, you stop the treatment, see how you do. If you're still positive, you keep going. And I had progressed pretty fast. I had progressed a little bit faster than what the taper said. From the best of my understanding, after the 3rd week, you should be up to a quarter tablet every day. And by the end of that 3rd week, I was just slightly ahead. I think I was up to half a tablet every other day at the end of that 3rd or 4th week. So I'd followed the schedule pretty close. And over the winter, I had the best winter since my disease started in 2019, mast cell activation syndrome. My breathing was the best it ever been. My sodium was great. I was on the least amount of RX. I wasn't on any mast cell stabilizers. I was washing my veins in the dead of winter at 30 Fahrenheit. I had good tolerance to heat, cold. I was doing a lot of detox, car sauna. I was doing a lot of, I was exercising. It was actually Christmas Eve. I was actually walking the park. I still couldn't go in stores real good. I actually could pick up, a canister of bleach, stiff it, and I was fine. I recovered 10-15 minutes. Don't recommend that at all. But, I would do tests and I could see the improvements. I could see, the changes and all that, And thankfully, just over the winter, it seemed like I kept improving over the cold weather. And the pollen season has started here in Virginia about March. And I'm so resilient when I do bad or when something repeats, because me and sensitive don't mix. When something hits me, I actually forget about the disease when I do well. I don't sit there and I don't think about it and, all this when I do well, because I only problem solve when I can't function. So I started having my first bad days about March, I think it was March 23rd. I'd go outside and I'd just start gasping, just like I can't breathe, I didn't have no energy. I went down to Statesville, North Carolina, everything had bloomed down there, and I just couldn't. It's like when I get out of the car, I just felt weak, I couldn't pick my legs up. I was gasping for air. I need to get back. And this was even wearing my respirator. It's like it was getting to my respirator. And it was just like all of a sudden my body just, it crashed. And I'm trying to figure out what in the world's going on, I'm like, what's happening to me, this is like when my disease first started, I can't even go outside, go outside and I'm, so I looked up, I went on pollen.com and I looked up and I seen the pollen levels was way up. And sure enough, it was March 23rd, the first bad day that I had. And it was the first high day that the pollens was up. So I thought, okay, that's what's going on. The other thing that I started noticing was my inflammation started going way up. My face started swelling up. My belly started getting big. I was only eating once a day. Not that I didn't have an appetite, but I just really just didn't want to eat, you know. My belly just kept getting bigger and bigger, and I kept putting on weight. It's like I wasn't urinating. And I didn't know what was going on, you know. It's just like like I said, it's just like you know, I just went downhill. And it was like springtime of last year all over again, except it was 5 times as bad because I couldn't even put my respirator on, you know, without it really even helping me. It didn't seem like it was even getting through that. And you know, I'd go outside and it was just like, you know, suddenly my voice would get raspy, you know, I like it when I talk. You know, I was like, how you doing today, Hunter? I'm doing okay. You know, it's like I was just getting choked, you know, like 200-pound guy just choking me. You know, so my throat was swelling up, you know, my nasal passages was swelling up. So I know it wasn't in my mind, you know, and but it was just hit me terribly hard. And everybody was getting upper respiratory infections. I mean, everybody, like 7 out of the 10 people that I knew was getting respiratory infections. But anyway, enough about that. So basically what the point is, I was in remission over the winter, then I had extreme fallback, you know, as the pollen season come in. I was very reactive, very sensitive. My chemical sensitivity was through the roof again. And they all kind of follow each other. So anyway, back to the story. Somebody blew the horn, I didn't know who it was. So anyway, I had a major setback and I didn't know why. And which I'm sure it's a combination of things. I'm getting ready to get into that. So my belly just kept getting larger and larger, my face, the inflammation, and then I looked like a totally different person. Hair started falling back out. So I thought maybe it's my liver, you know, maybe. And at this point I backed off on my chelation. I hadn't hardly touched it in 2 months. The binders I'd only been doing once a week. I still was doing the Epsom salt baths. I wasn't doing the sauna a whole lot because I know my body was under a lot of load with the Lyme treatment already. And I did it in the beginning, but it was just too much and I backed off. So, out of breath right now, just talking. So, I went to the Radford ER, which they done basic blood work, and they said that was standard anyway. I had my blood work done every 2 months to check my liver and my kidney function, but I went to the Radford ER to be on the safe side, and my ALT was up just a little bit, nothing to be concerned about. Told me everything was fine, you know, everything was hunky-dory. Go home, take your medicine. But what was weird about this pollen season was I wouldn't respond to any of my antihistamines. I wasn't responding, which I was always like it with mast cell activation syndrome, but this year it was particularly worse. You know, it helped like 20-30%, but this year it was like 0%, you know. Antihistamines wasn't working, none of that. And on a side note, over the winter I'd been doing so well. I was off all my mast cell stabilizers. I was on the least amount of RXs. My hemoglobin returned to normal. My PCP said my chest sounded better than it ever did. And, you know, it was just like I was pretty much almost in this kind of remission. This bucket ain't supporting me too good. I don't have nothing to sit on yet. So when the pollen season hit, you know, I wasn't responding to anything. I was taking 4 Claritin a day. I started a chromium sodium back. It wasn't doing nothing. My dexamethasone wasn't doing nothing. And people says, all the dexamethasone makes you swell up and everything, but I was on the lowest dose. I'd been on it for a year. I mean, it never made me swell up, never had any, symptomatic problems with it. Went to the ER, everything was hunky-dory. And so it was April, so I'm gonna look on my wristband here because I still got it on. It was April the 15th. And I had other little minor things, I'd had a kind of a headache for 6 weeks. April the 15th, woke up, I was aggravated, didn't start out a good morning, the pollen was high, I had my respirator on. I know I needed to get out, and I know I needed to move. There was pressure on me there, so I was loading the mattress, I was fighting it while I was gasping for air. I was pushing it in my car, and it seemed like I was so reactive. Dr. McCarter says it's outdoor molds. I don't know if that's true or not, but it could be a combination of molds and the pollens, because they're most active in the summertime here. But anyway, I'd just go outside when the pollen season started and my heart would jump up, 140, 150 because of the stress on my body. Just going in, I'd have to wash the pollen off, as soon as I went in, because just getting on my clothes, I'd hack and carry on and all that stuff. But anyway, I've been battling bronchitis for about 3 weeks. And the days leading up to my mini stroke, I didn't feel good, and I didn't have energy in my legs, like I couldn't get up, I couldn't go. I'd backed off onto the Risifram, and it's not the medication itself that's dangerous, it's the Lyme die-off, it's the toxins they release when they die. So I started getting weak, started getting tired, I was going to bed earlier. And I didn't know if it really was the Lyme medication or the pollen or both. I say it was a big combination, stress and moving. And so that morning, I didn't feel well. I was coughing my head off. And, I'd put on like 20 pounds in, like 4 weeks. And I wasn't eating but 1 meal a day. So I was loading the mattress in the car. The day of that it happened, I was straining getting it in there. I was gasping for air, and I was already aggravated. It was hot. It was already like 80 degrees that morning. The pollen was through the roof. It was like 11. Didn't even need to be out there. But I had pressure from a person to get it done. And I wanted to move myself anyway, but so I got the mattress in the car, and I got up here, and I got to cleaning. Family member was helping me. I was aggravated. It was hot. I was trying to get the steps on. The wind was blowing like crazy. I was trying to hold on to it myself. And the more I done, the more aggravated I got. And it was just, I didn't have no rags or nothing to clean with. And it was getting a mattress in here, and it was just not a good day. And all of a sudden I just started having a busting headache. I mean, it was just a really strong, intense, busting headache. And about an hour and a half into doing this, my heart rate was through the roof. Because anytime I go outside, it was just like putting a lot of stress on my body. And it wasn't that I was out of shape. I was in great physical shape. I mean, on Christmas Eve, I was back to walking the park. It's be 30 Fahrenheit, and I was walking 4 or 5 miles because there wasn't no pollens or molds out. Could I run a marathon? No, I couldn't run a marathon, but, I still couldn't go in stores and stuff, but I started getting tingling in my fingers. I started getting the side of my neck that started like it was in a cramp. It just started feeling hard, just something just didn't feel right. And I got cotton mouth a little bit. And I've got that way before, and it wasn't really a concern. It was like I got that before. Get too mad at work or too hot, or get an argument with the boss, or just something everybody's done. Just so the headache just kind of kept coming on, and I've had that light headache for about 6 weeks, and it just progressed. So I got in the car and I told myself, well, it'll be okay, it's just, I've had this many times, no big deal. And even before I got sick, and before I had to quit my job due to all my sensitivities and, all this other stuff that's hit me, I went to my grandmother's and I started getting, I felt blank. It's like, just out of it, brain fog, I sat down, I fixed some chicken tenderloins, and I got them cooked. And at that point, the headache and stuff started subsiding, I thought, okay, it's gonna be okay, whatever. So it pretty much left my mind, I thought, it's a bad day, just need to rest, So later on that night, I went back out and I took the trash out and it flared me back up. I come in, took a shower, and the headache started coming back. As I said, the tingling started coming back, my fingers, side of my face started feeling, excuse me, still got tongue tied, started feeling funny. And it just kind of kept progressing, but this time it was different because it was scary because it'd come back. Usually all the other times I've got really mad or upset, once it went away, it went away. And usually after I slept it off, that was it. So I decided to go home to the ER. It was about 8:30 that evening. And I got to the ER. I told him, I said, I think I'm having a TIA or a mini stroke. So the lady hollered triage, and they sent me on back. Wasn't no waiting or anything. When it comes to that, they don't play around. They send you on back. Sorry about that noise. I'm sitting on a bucket because I don't have nothing to sit on yet. They sent me on back. A doctor that was attending, the ER physician, he had me do the pull test, push test, touch the tip of my nose, touch the tip, my other tip, touch the tip of my nose with my other hand. I checked my sodium levels, they done my creatinine and all that. And about 2 hours after I was admitted, I started losing my speech. And the first thing that came to mind was, oh no, I'm having a mini stroke, or I'm having a full-blown stroke. Luckily, my right side works fine, my right foot and all that works fine. So it started affecting my speech. When I talk, I couldn't get a word, I was like that. And the doctors, they had that look on their face like, we got a TIA victim or something, because if this lasts more than 20 minutes, it's not a seizure, this is not a seizure event. It was going way past 20 minutes. So it was really scary. This was progressing. This was 4 hours after the initial, well, actually about 8 hours after the initial event when it started. And as this started progressing, the thoughts come to mind like, am I going to be able to wash myself, or am I going to be able to doing my avoidance, you know, who's going to take care of me? My parents was almost 60. You know, am I going to be able to stay by myself, you know? And I'm not out of the water yet. I mean, this is just 2 weeks post-stroke, so they done a quick CT scan. Sure enough, it was all right. Everything was hunky-dory there. TIAs and mini strokes don't show up if it's not a significant event. So the speech impediment, and I kept talking in circles, you know. It's like I just kept repeating myself. I started getting where I couldn't get my words out, and you know, I felt almost like Daffy Duck, you know, when I talk. You know, I'm not laughing at it because believe me, it ain't fun. It ain't nothing to make fun of. That's why, you know, I try not to make fun of people, anybody with disabilities or anything like that, because you don't know their story or situation. But so this event had progressed. By that night, I basically couldn't talk. The next day, when my dad had seen me, I was the same way. The nurses, they was looking at me like, what was going on, you know? So the doctor come in the room, he's like, we're going to admit you to Monday when our MRI team comes in. He said, do you want to be admitted? And I said, yes, I want to be admitted. Because working in a laboratory, I've seen hundreds of strokes, TIAs, all that. I watched my father have a stroke. And I know how these events can go, you know. It can go from, you know, fine 1 minute, can't put your shoes on the next day, and then dead the next. And I've seen other people have it last 15, 20 minutes, go home the next day and be fine. So the doctor admits me, and they kind of watch me, keep an eye on me, you know. They're in the room about every 20, 30, 40 minutes. And the next thing they found out was, they said, son, they said, your creatinine's high. You got acute, they call it acute kidney damage, which is basically the same thing as stage 1 kidney liver failure. My body was not processing toxins, and that showed on the high creatinine. So my body wasn't processing anything. This was a telltale sign I'd been overdoing it with the risofram or the binders or something. But it was confusing because the days leading up, you know, when I started getting symptomatic, my belly swelling up and stuff, and I looked like an alcoholic because of my face and stuff, and my belly was swelling, you know, like a jaundice reaction. I'd already been backing off on that stuff, but undoubtedly this had been building up, and it just, my body, my organs just basically was kind of failing. And if you look on the Lyme disease support groups and all the other groups, they all kind of follow the same pattern, you know. It's like, you know, my husband wasn't kidney failure, or my husband wasn't liver failure, and he had a stroke, and this and that. So I'm sure this contributed a whole lot to my stroke. My body was just under that much stress, and then having bronchitis on top of it. Luckily, Saturday about 3 p.m., my speech had come back. I still stutter from time to time. I still have some, you know, some of that. Thankful to be alive. I'm thankful to be in my shed now. Hopefully it works. I've been in it ever since I got out of the hospital. I'm hoping that it stays true and that my body's able to tolerate it. I'm hoping that this is not permanent. What little bit I do have, but I can use my right side of my body. You know, gotta be careful. I mean, you gotta be 100%, and like my mast cell doctor told me, you know, he said you have to go at the pace that you feel like you can stand. And you know, the goal was 2 tablets, and I was getting very close to that, but I was having to back off. But each day I got better and better. And some days it's like the speech impediments, you know, it's like it's barely there, and other days it is. If I get too hot or if I get too stressed, it's like it exacerbates it. Or if I try to think about what I'm saying too much. So just be aware when you treat Lyme disease, and it's not necessarily the medication, it's the toxins they release as they die off. And a lot of Western medicines is going to call bullcrap on that, but you know, I was doing all the protocols. I was having all my kidney and liver functions checked every 2 months. My chest is sound better than it ever did. But it was like this big combination, you know, the pressures are moving out, the stress on me there, you know, the money, stress, you know, treating Lyme disease, you know, what that was doing to my body. And I just restarted the Ristifran, but I'm going very light, like quarter tablet, couple days, take a few days break. So lesson from the wise, go low and slow, because when you don't go low and slow, I mean, you really can mess yourself up. It could have been a lot worse. And I'm not out of the water yet. I mean, you know, it could be a bleed there and it could come back or anything, but luckily the MRI didn't show anything. I was released that Monday, and I'm happy to be talking to y'all. So if I don't get to all the comments and stuff, I appreciate all the prayers and the donations. So if I don't get right back, I apologize. I've mostly been sleeping and resting. I'm going to get ready to go to a neurology appointment, and we're going to talk about it. And before I go in and out, they did see an issue with this artery, like a spasm in my neck, and with massive activation syndrome, it actually can cause hypertension crises when you're stressed or you're upset. I'm sure that contributed because I had so much pressure on me with the treatments and everything else, and that restriction that they seen on the ultrasound, it probably cut off blood supply to my brain, and that probably caused a TIA, because that's what TIA is, temporary disruption of blood to the brain.
You must understand there will be a price to pay. Only thing you're complaining about is how to have what I want without paying a price. There is no such life. If what you want means so much to you, you must pay the price. But if you find the price is too much for what little you want to do, you will step back naturally. This is so with every step in our life. When we want to do something, there will be a price attached to it. We must evaluate, do I want to pay this price? What I want, does it mean so much to me? Some people want it so badly, they're willing to pay any price. For some people it's a passing interest, so they will drop it and they'll go on. There's nothing wrong with both are fine.
God gives you a